I will.
All right. We are live. I just want to go live here. Just checking. Where are we now? Good morning, everyone, and welcome to another World Nutrition Summit live with one of our speakers, Bitten Jonsson. I am just quickly checking if we are live on Instagram. It looks like we are moving. Yes, we are. So we are having little short interviews so that you guys can get to know the speakers, get to know the topics, and understand exactly what the summit is all about. So today we've got Bitten. So I'm just going to give you Bitten's biography, a very short one. Bitten is a registered nurse and certified addiction specialist and the international renowned force behind the sugar restriction diagnostic tool, helping thousands of individuals worldwide breaking through free from food addiction. She has been dedicating her life 30 years to this fantastic cause, and we would just like to welcome Bitten to our little sneak peek live. Thank you for joining us, Bitten.
Well, Maritza, thank you for having me here. I mean, this is so exciting. It's one of the most exciting things I've done in years and years to come down to South Africa and to be in a conference, where you talk about world nutrition meeting science. I have missed that for years in my field. Let me tell you, finally it's happening.
We are very excited to have you. I think
Yeah.
like everyone's like, Bitten's coming, we're ready, we're ready. So, Bitten off the bat, I'm just gonna, let me just say everyone that's watching, we would just want to say hi to Yana. Yana is on the line. She says, can't wait to meet you in Cape Town, Bitten. So if you have
Oh,
any
same.
questions, we are live for not a long time, but you are very welcome to pop in a question for Bitten if you want. Have a little chat. We're going to run through her topic and then we'll answer any questions that pop up in the comments. Fantastic. So, Bitten, tell us a little bit about your topic.
Well, I work with sugar and carb addiction. And, before a lot of people say food addiction, but I want to keep the word food for real food, which is the medication we need. So, a
Mm.
ketogenic diet, if I jump right into that, just naming that, is a medical intervention for addiction. Addiction is a brain illness. There's so many misconceptions about addiction, especially sugar and carb addiction, that it is about diet, willpower, and it's not. It's not about weight and diet. Those are consequences. So, one of the things that I need to teach people, I love to teach people, is to understand the core issue of what addiction is. And that addiction causes severe consequences physically, psychologically, socially, and spiritually. Actually, you're trapped with the food and your life dwindles and you get more and more consequences and more consequences. So if you want to learn more about that, Nutrition Network has a wonderful training right now with a lot of addiction specialists. But of course, I love for you to come to Cape Town and meet us and listen to us talking about this topic and the future of medicine, I would say. And I love your saying, changing healthcare one practitioner at a time. You've heard me talk, Maritza, and I talk about how do you do this? How do you stay without sugar and carbs? Well, you do it one step at a time, one day at a time. So I think it's very important to understand that addiction is a brain illness. And what I do, I work with it in a medical protocol. It's not, talking to you about, well, eat less, move more. That doesn't work.
Yeah,
Yeah.
absolutely.
So
No,
those are
I
important
agree.
points. Yeah.
Absolutely. It is absolutely. I love, I mean, I just did the course with you. I mean, it is absolutely the mentality. So my next question would be like, is there specific biological and neurological reasons why people with a sugar addiction rather should be on a keto diet?
Yes,
You're a
absolutely.
lifestyle. Yes.
Yeah. Well, first of all, to be sugar addicted means that you have a genetic, hereditary factor that you are sugar sensitive. Your body reacts to it. Not only your brain, your reward system, your reptilian brain, but also your pancreas. So too
Mm.
much sugar, carbs, in your body will create havoc, and it's going to affect the reward system. So, the ketogenic diet is a medical therapeutic diet where you cut down tremendously on the carbs. And most of all, you eat, animal-based protein, which will give you all the nutrients you need to, restore your mitochondria. The little fabrics in your cell that gives you energy. Because one of the things that my clients have complained about is mood swings, fatigue, foggy brain. I can't think clearly. I'm disorganized, I feel good for a minute and then I crash. What's wrong with me? I must be a bad person. No, you can't. I used to say you can't put sugar water in a Ferrari. It's not going to work. So you have to have the optimal nutritional balance. And it's amazing. I learned about this in nursing school 1974. So where did we lose this knowledge through all these years? And we live in a very toxic world, that toxic food, most of all, the processed, ultra processed. But a lot of people think that it's only the ultra processed food that is dangerous. No way. Any combination of sugar, flour, fat, spices that you can make yourself in your kitchen, cookie dough, will be addictive for a person that has this sensitivity. So I used to say that to have this sensitivity is a gift. It comes a lot of good stuff with being sensitive. And I also compare it to the Webb telescope out in space. That's a very sensitive instrument, but it isn't defect or bad, right? It is brilliant. So, but you have to sort of take a driver license on this sensitive body. So that's why we really cut carbs very, very much. And there are other food issues too. And if anyone needs to learn more about that, listen to Tamsin Murphy. She's adorable, talking, anti-nutrients and all kinds of things, what's going on with food today. So, that's why we eat a ketogenic diet, a very low carb diet on this very, very broken biochemistry and hampered brain and hampered body and microbiome and all that this food has caused.
Fantastic. No, it's amazing. It's absolutely, I think this is one of the most less subjects, or the biggest drug that people are not addressing is the sugar drug, because everybody, you can be 2 years old, you can have it. You can be 92, you can have it. Yeah. And we will never know. So I'm just dropping into the comments here. So Oswald also said, hi, Bitten and Maritza. And a happy, healthy woman said, there are so many misconceptions around addiction. Many people think it's all about self-control and that people with addiction should try, where it happened? Oh, there is it. Should try harder.
I know. I've heard this through all these years. And, my tribe is the medical profession, doctors and nurses and dietitians and nutrition coaches. And I've asked them, how come you don't address when you think you see an addiction? No. That's integrity, to ask people how they really eat or drink, or, it's their own fault. So, they don't want to change. And many of those craziness, and they're hopeless cases. They don't do as I tell them. Many doctors have said that to me. And I said, you're talking the wrong language. Their brain, parts of their brain, is hijacked by, an enemy ruling them. So they have loss of control. They don't want to do these things, but, they do them because they don't know anything else to do, because they don't have knowledge. Nobody support them or respect them and help them to say, why don't you do this instead? Do this instead. Let me help you detox from, the toxic foods. So your energy is restored, your mood is restored, your negative self-talk is restored. And then you could start, making up a plan how you want to live your life. But if something is in there, it's like, having somebody running your show, which we call the red dog for simplicity. That's a nasty little bugger. If that is going on, you lose control. And every morning you might say, today I'm not going to eat this junk food. Today I'm going to do, what I need to do. And you lose the battle every day. So remember too, that with that comes shame, stigma, because, sharp up, make it, it's willpower, has nothing to do with willpower. Eat less, move more, and all these, very superficial things that people tell us to do. People that don't have knowledge and don't understand that addiction is a deadly, chronic, progressive brain illness.
Absolutely.
Yeah.
Absolutely. Thank you. So Oswald also quickly popped in a question here. Wendy said hi, all the way from Canada. The upcoming nutrition summit in Cape Town looks amazing, she said. And Oswald asked here, hi Bitten, what is your opinion on using GLP-1 medication to curb your sugar addiction?
Okay, very good question, Oswald. And I like to answer it like this, which I've done with many preparations that have come through the 32 years I've been dealing with this, anything from amphetamine-like drugs to surgeries to antidepressants that they think help, and diabetes medication, and now we have Ozempic and similar stuff. I think that it could be a blessing and a very, very dangerous way to go, in a way. If somebody that has a severe loss of control in their addiction, and some of my clients have volume eating, they're always hungry, always craving, and I promise you, that's like having a pain attack, chronic pain attack, constant pain. And I know how they suffer, and I know how they try to stick to a food plan. But let's say that one of those clients, because we don't have a better, I would think that we should do tests on oxytocin medication in the stomach to calm down the stomach, but we are not there yet. Okay. So Ozempic is right now, could be a crutch for some people that will be assessed with this incredible craving, volume eating, and they can't get stop on it. It could be a crutch for a certain amount of weeks, and I think that could be individual, where this client get taught how to eat a good food plan, how to live, other tools like the breathing exercise, the sleep, the biochemical repair, the physical activity. If we would implement that lifestyle changes in somebody that could have the help of Ozempic for a while. And then, of course, it has to take a lot of skill of the treatment staff to help them withhold those tools when they quit, the medication. I think that that's maybe the way we should use it with some people. I think that some people use it very wrong. They take it just to lose weight. They think, you lose weight, but you don't. Makes you less hungry for a while. I've seen people quit it and they bounce back and they gain all the weight back and much more because they couldn't stick to the lifestyle. Because, changing lifestyle demands many, many, many tools in many, many areas of life. And it has to be a lot of support and most of all, knowledge about the brain and the body. And then you have a fair chance to do it. So that's my answer on that one.
Fantastic. So Happy Healthy Woman also asked here, are there different levels of food addiction? And would it be possible for someone who is a sugar addict to start introducing sugar processed or sweet foods again after a while in moderational way?
Of course, there are different levels in all addictions. You have a phase 1 where it doesn't show much. You hide, lie, and sneak, and nobody really knows. The same with an alcoholic. Then you have phase 2, which is a more severe phase of the same illness, where, you start being home from work, maybe have temper tantrums, being depressed, sick leave, not minding your family and so forth, because it's going to take a toll on you. Then you have the third terminal ill phase. It's the same illness in the same person, but it progresses through the years. So the third phase is terminal. That's when you have all the consequences you can imagine, and you're very, very, very sick. And you have one foot in the grave and the other one on a banana peel. So if somebody is diagnosed with addiction, and that's why it's so important to diagnose. As a nurse, I don't like treating guesswork. So that's why I use this instrument I developed, which is based on the same criteria as alcohol, heroin, cocaine, opioids. Because addiction is addiction is addiction, right? It's the same criteria for gambling, for any outlet. So if you are, I have to tell you, you have to abstain from sugar and carbs for the rest of your life, one day at a time. Because as soon as you take one bite, everything going to come back. Sooner or later, you're going to be back and you're going to be worse off, because we know relapse are progressive. They get worse over time. So
Fantastic.
no, you can't start eating it again. And if you have that thinking that, oh, maybe if I stay away now, I could go back later, that means you're not accepting the illness, and you don't have enough knowledge about addiction in your brain. So that's why you think you will have a back door. But sorry, you have to surrender. There is no back door.
Absolutely. Jana just popped in a question as well. She went, are there a link between sugar addiction and mental health disorder like ADHD?
Absolutely. I'm convinced it is, but I don't have any real studies to lean on. But I could tell with my clients that, and then I call it ADHD symptoms. So many of my clients have had so many diagnoses through the years: ADHD, ADD, depression, general anxiety disorder, bipolar, and we could go on with mental health problems. And once they get on a ketogenic food plan and they are abstinent, but it takes months. It could take 12 to 18 months before we see the result. And then I'm talking about other physical problems too, like fibromyalgia. I've had so many clients with that diagnosis. And, chronic ulcerative colitis, morbus Crohn, many of those things. And, it's amazing to see once they start healing the food, all these symptoms disappear. So was it really ADHD, or was it ADHD symptoms? And I like to point out to people that Weston Price, the dentist, about 100 years ago, traveled to a lot of countries in the world. And he saw that when a country or people introduced sugar and flour, they had crooked teeth, uh, mental problems, and he described the mental problems and also inflammations and infections. And he described that if you read the symptoms he saw, it is ADHD symptoms, or we talk about it today. So I'm sure there is a connection. I'm absolutely convinced. And anyone on some of those mental problems should definitely eat a ketogenic diet and be patient, because the brain takes time to heal.
Hmm. That's very interesting. That is
It is.
absolutely.
It is. And
I'm just
I can swear by it because I've seen it so many times. I even had a psychiatrist call me once and said, what have you done to my patient? And I said, what do you mean? I got scared. Well, I diagnosed this woman with borderline. And she comes back to me now 4 years and tells me that she'd quit eating sugar and carbs. She doesn't have borderline anymore. No, could it be that she got borderline symptoms because her brain was malnutritioned and her body was in insulin resistance, and insulin resistance in the brain and in the body, and her microbiome was broken. And we also know today a lot about the microbiome's quality is very important for craving and for nutritional uptake and health. So, everything in the body is connected to everything. You can't
fantastic.
split people in psychological and social
Very
and physical. You can't. You have to understand that it's all connected. So when I start working with clients, I work with the whole patient, all
good.
areas, of course.
Yeah, Jana also just went second round. She asked, Bitten, have you seen sugar addiction in children? I get so angry when I see what children are being fed and what food are being marketed to parents as children as healthy. Yes.
Jonna, I agree with you. I could cry when I go to the grocery store and I see this. And today we also know how dangerous it is for pregnant women to eat a lot of sugar. That affects the child. So it's not only as a little child, it is very, very early. And I have done hundreds and hundreds of sugar diagnostic interviews. And it's very, very clear that the first symptoms usually come about 3, 4, 5 years of age. And then, the progression is that they start being what people call a cookie monster or, sugar tooth or something, jokingly. But in the teenage year, when they feel swollen from insulin on the inside, the tofu, thin on the outside, fat on the inside, and or overweight, chubby, they start being bullied and start feeling shame because they call gluttonous or whatever. So most sugar addicts that I see, the illness developed very, very early. So of course we should never give kids these toxic foods in the ideal world, but we have been normalized that that's what we do. So that's very sad. We're going to see a lot of sick people in the future. And Nutrition Network and the World Summit is going to try to change that. That's why we're doing this. That's why we have this world conference. That's what we're going to talk about. That's what we're going to show you, that this is very possible. But we need to support each other as staff, as people knowing this, because we are the UFOs out there, right? The aliens. Yeah, and that's why I love Professor Noakes, because he is a trailblazer. And before I met him, I felt very lonely being a trailblazer and a weirdo. And then he came along and he did it, blasted it out. And I said, thank you, thank you, thank you. And I'm going to meet him. Woohoo!
So I wanted to share in South Africa certain food shops, certain wholesalers or where we purchase, where our aisles, it's very interesting, are created in a method where all the loose candy is situated on your way to the till to pay for your
Of
shopping.
course.
You have to
Same.
walk, your children have to walk through there to get to the point where you pay for your groceries. And I mean, my kids are a little older now, but I have seen moms battle like wrestlers to get sweets out of children's hands going
Yeah.
through those aisles.
Yeah, and
Um,
kids get temper tantrums. But remember, these kids are not bad or trying to manipulate the parents in a power play, which some people with the only psychological eyes on. It is their brain screaming when they see this, because when you work with sugar addiction, you have to understand cue induced craving. That comes from seeing that food, smelling that food, hearing about it, like eating popcorn at the movie theater. Cue induced craving is the biggest problem we have when treating sugar addicts, because of the early exposure and the constant exposure all the time. So this is a huge, huge problem. And here now, I went to the grocery store yesterday, and now when you go into the veggie department, they have this huge tower from floor to top with energy drinks. Those
wow,
horrible, horrible, disgusting energy drinks, extra price. And I think, that is almost criminal by the store owners to
mm,
put that there, because who's going to buy it? Anyone that walks in going to put a lot of those cans in their basket.
it's
Horrible,
crazy.
horrible, if you ask me.
I mean, it's all a gimmick. It's all everywhere
Yes,
to get
money,
people
money,
just
money. Yeah,
money, money. Yeah.
yeah.
So just again on the comment side, Jane said it's lovely to see us. Mandisa said thank you for the discussion. It's very excited to hear from you. And then Johanna said yes, she's agree. We need to create more awareness around this and more conversation and getting these discussions into rooms where it really matters and can make a change.
Yes,
Yeah.
schools, society, healthcare system, everywhere we have to talk about this.
Absolutely. So I don't even know where I am at my questions at the moment. We're like having such a fantastic conversation. So we've spoken the need to treat sugar addiction as a real diagnostic condition. What do you
Yes.
think needs to change in the mainstream medicine or public health in this regard?
Well, we have to give, first of all, the medical profession, and that's what you guys are the best in the world doing, with your teaching platform, teaching medical professional that you don't have to be terrified of addiction. We talk addiction, we teach addiction, and I think it's wonderful when doctors come to my training and I ask them, how's your attitude towards addiction changed? And they go, it's amazing. I thought it was, bad character or low moral, low willpower. It is a brain illness. I understand that now. So I'm going to embrace this and learn more and work with it. Yeah, yeah, yeah. So that's what we need to do. And in the public eye, we need to question, everywhere where you sell junk food, where you provide it for kids in school. I think parents should start groups, where they start for looking at their own health, because it starts with yourself. So how am I eating? And grandma, grandpa needs to, get taught because they like to comfort kids with candy, right? We have the problem in Sweden. Oh, but it's not going to hurt with this and that. Well, it can hurt in the long run. And then, of course, in the whole school system, we need to work with this and make it unnatural to provide this to kids all the time, and also connect kids with mental problems with what you provide their brain, because the brain runs it, right?
Yes. So amazing. So my last question here, Bitten, would be for today. What is your message to someone who suspect they may have an addiction to sugar, but feels overwhelmed at the idea of giving incompletely, going, right, I'm an addict. How would you
Well,
say?
first of all, I would like for you to meet some of my professionals that do the sugar assessment, so that you really have a good picture of, is this my problem? And if it is, what are my consequences? And then a strategic plan, step by step. What am I going to do about this? And, the reason people feel overwhelmed is because, sugar and carbs deplete your body and your brain, every mitochondria, on energy. So you think you might be depressed, but you're not. You don't have enough energy in the cells. So we need to first work with something we call biochemical repair, where we restore your energy. So once you feel, oh, I'm start feeling energy now, then we could take the next step and see what kind of journey is best for you. What more do you need to do? And remember, it's always one step, only one day at a time.
Fantastic. Bitten, I want to thank you for
Thank
taking
you.
time out of your day to answer
Thank
our fantastic questions. I want to remind everybody, Nutrition Network, our team already posted it in our group chat. Nutrition Network's course with Bitten, professional training, carbohydrate and sugar addiction. Go have a look at it. And come and meet Bitten in person. I mean, come to Cape Town. Who doesn't want to be here?
Yeah,
It's lovely in October. And we just want
I've
to
checked the
say,
weather. Yeah, I've already checked the weather. Yeah.
you can bring your shorts. It will
Yep,
be
I
great.
know. I saw that. It's Swedish summer.
Lovely. So
Yeah.
I just remind everybody, thank you again, Bitten. Any last words? Anything you want to say? We've got 1 minute and 30 seconds.
Yeah, get rid of the shame and learn about your body and your brain. Restore yourself to energy and health. Please, I really want to encourage you to do that.
All right. Thank you, everyone. Thank you very much, Bitten. And I will see you all on our next live. We don't know yet who it's going to be, but it's going to be one of our fantastic speakers, just giving a little bit of a highlight that's got to do with our World Nutrition Summit. You can find it on Quicket, World Nutrition Summit 2025 Quicket, for your ticket, virtual or in person. But come in person. It will be
Yeah,
so
come in
nice to meet
person.
you.
Yes,
Yes.
please.
Thank you, Bitten. Thank you, everyone.